Now, those who railed against lockdowns predicted exactly this: that excess deaths in the aftermath of unprecedented prevention measures, closing the country down and cutting people off from the vital services and lifelines that support human existence, would result in many, many delayed deaths. But did government policy actually kill more people than the virus itself? It is a damning accusation that should shake the world to its core. Official figures out today show that around 1,000 more people are dying every week than would be normal at this time of year. But at its peak, COVID was taking the same amount of lives every single day, even with stringent measures in place. Was closing normal frontline medical services a necessary move to stop even more fatalities, or a fatal mistake that should never be forgiven? And could the events of 2020 go down in history as one of the biggest global scandals? Well, joining me now on the show is Jamie Jenkins, who's an independent statistician and political commentator. Jamie, let's talk about these statistics, sort of eye-grabbing headlines today saying that lockdowns could well have killed more people than COVID itself. Is that a bold extrapolation, or do you think the figures would actually back that up?
Well, I think that statement itself, Alex, is actually false, because what they're focusing on there is actually current deaths at the moment, because we know that we had significant numbers of COVID deaths through the pandemic. But what we're seeing, and it's been probably for the last 2 or 3 months now, Alex, across the country, is that when you strip out people who are dying from COVID, then they're relatively low to what they were in the past. And then you look at the number of deaths in the country and compare them to the 2015 to 2019 average, we are seeing kind of deaths above average. There are around about 1,000 a week, and they're across a range of different age groups as well. And so I've been looking at the facts and figures. I used to lead the team at the ONS who produce the figures each week, and we're seeing kind of 10 to 14-year-olds. They're about 11.7% above average. People in their 30s are running somewhere between 11 and 12% above average. People in their 50s and 60s are over 10% above average as well. So we are seeing deaths that are not COVID, and there are other factors above average. And we can look at some of the causes in the deaths that we get each week as well. And some of the factors that we're seeing at the moment, Alex, is we've seen circulatory diseases. So those are things related to the heart. So heart disease, heart attacks, they're above average. We're also seeing diabetes deaths above average, and people who are having strokes are above average as well. And they could be a factor of not just the lockdowns themselves that we had in March 2020 and a few other restrictions throughout the pandemic as well. But remember, we were all told to stay at home, protect the NHS. A lot of people have avoided getting those kind of health checks or going normally forward to the NHS, and that could be contributing to some of this as well.
Those nightly press conferences that the government was saying it was following the science and basing their decisions on models that were made, essentially, that in the process of doing things like unlocking, of allowing hospitals to run as normal, it would create a far greater spike in deaths. Are we at a stage yet where we can really have a look with a critical eye at those decisions taken at a time of crisis and see them as having been perhaps overzealous or exactly the right thing to do?
Well, the modelling through the pandemic was quite shocking, actually, Alex. You look at where Boris Johnson last winter was asked to go beyond the measures that were in place, and they were predicting kind of these doomsday scenarios. And the actual deaths that we saw were around 90% lower than what the kind of the midpoint in terms of the modelling was when Boris chose not to go further. Look at more recent times as well. We've just had this latest Omicron wave, and there were, again, calls for people to put more restrictions, bring back masks, and all other things in the kind of the economy. But we didn't, and we've seen the cases rise. They've come down after about 4 weeks. So, we are learning as we've gone through. I think one of the things we've also got as well, Alex, is that at the moment, we're seeing record people rocking up at A&E. People can't get GP appointments, so they go to A&E. We've got about 13,000 patients in English hospitals who are ready to discharge, but there's not enough care in the community for them to go. And what that means then is somebody could be in A&E, ready to be admitted to the wider hospital. They can't because the beds are being blocked. Ambulances turn up with new patients. They're then stuck outside, so the patients are stuck on the ambulance. Somebody then seriously ill phones for an ambulance. They can't get one. So the whole system at the moment is probably contributing to these excess deaths, not just the government policy of lockdown, but just the government policy around managing the NHS overall.
Jamie, thanks so much for coming on and shining a light over the statistics. Jamie Jenkins. Well, joining me now on the show is Anthony Hinton, who's a retired NHS surgeon. Anthony, thanks for coming on. I mean, do you think that delaying all of these routine surgeries, it's creating this huge logjam now that could well be contributing to problems we're seeing in the NHS and that rising rate in the number of deaths, was a major mistake, or did the government have no choice at the time?
No, I think the lockdowns were a major mistake, and a lot of doctors have been questioning this policy right from the beginning. And if we look back to before March 2020, the pandemic plans actually specifically said that the economy and the health services should not be locked down. This has never been done before. It was always known that it would cause large problems with health, with the economy, with education. Jamie's brought up some very important points. If we look, for instance, at the problems getting patients into hospital, absolutely directly relates to the problems with getting patients out of hospital into care homes and getting social care for them in their home. But we have to remember that over 100,000 care staff left when the government tried to force them to have vaccinations with their vaccine mandates. Now, I think the current excess deaths are a combination. They're a combination of lack of proper health care over the last 2 years, and indeed that's still going on. If you're unlucky enough to have a heart attack or a stroke, but the ambulance gets you to hospital within maybe 30 minutes, you're almost certainly going to survive, and you probably going to survive absolutely with no disability. If your ambulance is delayed for maybe an hour or 2 hours, you've got a good chance that you may die. And if you survive, a much higher chance of ongoing disabilities. And the third issue with these excess deaths is that we know from the yellow card reporting system, the government themselves records that over 1,500 people died very shortly after vaccination. And that's probably underreported by about a factor of 10. So it's a combination of things.
Yeah, Anthony, thank you so much. You raised some really, really important points in that interview, and we haven't got time to build upon them all, but I do appreciate you coming on and bringing them all up. Anthony Hinton, who's a retired NHS surgeon, will join me throughout the show, is former Brexit Party MEP Ben Habib. I mean, both guests there basically saying, yeah, the statistics aren't painting a very good picture at all. And if this is the case, it really does raise some really serious questions about quite what government policy has done to people, essentially costing lives.
Yeah, well, I mean, the government has been challenged to produce its cost-benefit analysis, if you like, for, going for lockdowns, and it's steadfastly refused to do it. And they weren't following the science, were they? When you described government policy, you said that government said they were following the science, but they were doing it through modelling. And any half-decent scientist would tell you that modelling is not science. Modelling is, rubbish in, rubbish out. It may be a very fancy Excel model, but actually if your assumptions are a little bit out, the outcomes can be way off target. And what we do know is that total deaths in 2020 were not far off total deaths in 2019, and the same for 2021. And we're beginning to see excess death now. What we do also know is absolutely concretely is that we've got a cost of living crisis. And we heard earlier on the news that the NHS is talking about that turning into a humanitarian crisis. I think that's a bit of hyperbole, personally. But, the economy and health are not separated. They are integral to each other. And if the economy suffers, of course health is going to suffer. And we're only beginning to see the effects of 2 years of intermittent lockdowns. We're only beginning to see it. And this, I think the world is fundamentally unbalanced at the moment, politically, geopolitically and economically, because of lockdowns. And it's going to take a long time to bring the world back into some kind of balance.
Yeah, it's increasingly looking like it was a dreadful, dreadful mistake that's been committed around the entire world. Ben, thank you. Want to know your views on this? Do you think lockdowns were unnecessary? You can email me, gbviews@gbnews.uk, or tweet us at GBNews.